Healthy Seminars to another one of our Community Unity Immunity lectures. This is something that we started last year during the lockdown, and it's been great as we were just chatting just off camera, how great it is to see the faces and connect to people from all over the world. And it's our way of staying in touch, and we get to learn as well while we do that. So thank you so much for being here with us. Today's lecture is facial aging through the eyes of the patient. Our speaker is Shellie Goldstein, but we'll get to that in a minute. First of all, I just want to say, obviously, a big thank you for Shellie for being here with us. I want to say a big thank you to Lorianne for being in the background, making sure that everything is working fine. And my name is Sandra Grassa, and I will be your moderator for today. Please use the chat box for any questions during the presentation. We will collect all those questions and just put them through to Shellie at the end for the Q&A. And also, it's good to know where you're from. So use the chat box just to say where you're joining us from. And if it's your first time here, then just get connecting with our colleagues here. So as I said, today's lecture is called Facial Aging Through the Eyes of the Patient. I'm just going to go and share my screen here. Again, off camera, I was just saying to Shellie and to everyone that was coming in that it's been great the last time that we had Shellie on Healthy Seminars. It was great. And not only we have her here today for this lecture, we are going to have her in with us for the weekend as well. So for those who are here and are registered for the weekend as well, I can tell that you're in for something special, because I still remember the last time that Shellie presented on Healthy Seminars, and that course was amazing. So the one on Sunday is called Cosmetic Facial Acupuncture, Treating Aging Facial Concerns from an Eastern and Biomedical Perspective. If you haven't registered yet, you can still go ahead and register. That is a CU course for 4 live CUs. So if you need your live CUs for your renewal for your license, please do go and check that one out. There's more live webinars upcoming, and you can check them all there. There's also, for those that are watching this, and if you missed any of the other webinars from the series, you can go on the Healthy Seminars Community Library, and that's where you will find these Community Unity Immunity lectures. So there is a fee for this. There's a nominal fee to join the library, but what you get with that is we've just gone over 200 lectures. So there's hundreds of hours of content there, from these free lectures up to things that we had recorded for both Healthy Seminars, Pro-D, and also with Medigogy as well. So you can find all of those lectures there. There's no CUs for it, so you're not restricted with time. You can just sit back and enjoy all of those lectures. Also, for those that I've noticed over the last week, it's been great that we have, because people asked for, and a lot of you here, I can see the names popping in, and I know that you've been asking for this. So the IF Symposium, the registration has been reopened. So we've extended the registration, and we've also extended the access to the lectures and to the CUs that are there. So if you haven't registered yet, again, pretty much like what you see here, people coming in and connecting, and the forums on the IFS have been really, really amazing, where you can connect to the speaker and, just like here, be online and actually asking the questions to the speaker. So it's pretty amazing. So what I wanted to just remind you for today, before I introduce the speaker, is that what you're going to get here today for this lecture is for educational purposes only. This is not a medical diagnosis. It is not medical information for you. If any condition is mentioned during this lecture that you might relate to, this does not constitute medical diagnosis. So please do seek out medical attention if that's the case. Just to give you a quick introduction, and just before I pass it on to Shellie, just for those who don't know, Dr. Shellie Goldstein is widely considered one of the worldwide experts on cosmetic facial acupuncture. She is the author of Your Best Face Now, Look Younger in 20 Days with the Do-It-Yourself Acupressure Facelift, and creator of the Touch and Glow. the to do it yourself acupuncture facelift kit. As a leading author and educator of cosmetic facial acupuncture, Dr. Goldstein founded the Academy of Advanced Cosmetic Facial Acupuncture, which has recently partnered with the Pacific College of Health Sciences to present the Facial Applications of Cosmetic Enhancement Training Program, aka the FACE program. The FACE program offers a flexible combination of virtual interactive classroom learning and hands-on intensive clinical mentorship and training. Shellie has been featured on major television and cable networks and in the press. She is also a columnist for Acupuncture Today News. And we are super, super happy to have you here with us, Shellie. So without any further ado, please share your screen and tell us, how can we look younger?
Oops, hold on a second.
Yeah.
I just made a mistake here.
Yeah.
Hi, everyone. Let me just figure this out. Hold on.
This is cool. This is the joys of doing everything live, you know?
Yeah,
there's no safety net, huh?
There is none. Here we go.
Okay, thank you.
Great. Okay, hi, everyone. And thank you, Sandra. Thank you, Lorianne and Healthy Seminars for hosting me today. It's really a pleasure, always a pleasure to be here with you and to present. And the people that you draw in these lectures are just so exciting and smart and curious. And so I thoroughly enjoy my time with you. So thank you. Today I have a different presentation. Usually I talk about facial acupuncture from a biomedical perspective, from a Chinese medicine perspective, and from kind of the eyes of how to diagnose and treat facial acupuncture. But in thinking about today's presentation, I decided to take a different approach. And what I really want to talk about is the perception and the perspective of the patient. So when our patient comes in and they say, oh, I don't like my wrinkles, or I don't like the way that I'm looking, I'm starting to look like my mother or my father or somebody else, what are they really saying? What are they really telling you? And how do we understand that and then interpret that into our medicine of Chinese medicine? So that's today's lecture. When we think about facial acupuncture, we think about it as a deep rooted system in our culture of Chinese medicine. It was known as Mai Rong, meaning beautiful appearance, and it was noted throughout China and Asia for centuries. It was usually in the form of acupuncture or herbs, topical or digestible, and it was notably, so they say, used by the ancient empresses and the emperors to keep their concubines looking healthy and beautiful and radiant. It was also practiced for a different reason as well. Not only was the aspect on beauty, but it was also a form of a holistic treatment. And it was designed to not just enhance beauty and delay the visible signs of aging, but it was also to promote systemic health and well-being. And this is key. When in 2014, I was part of a facial rejuvenation needs assessment program, and we sent out a questionnaire to all of the participants in the NCCOM, acupuncturists, and we asked them the question of all of your patient load or your patients, what percentage of them inquire about acupuncture for appearance enhancement? And what came back was 62% of the people of their patients inquire about acupuncture for appearance enhancements. Now, this was in 2014. That's a lot of people. What is going on here? Notably, it's also cosmetic facial acupuncture is one of the top 3 or one of the most popular specialties among professionals in the United States. So what's going on? Why are they coming for us? Some people come in my caseload. I would say about 95% of my patients come for facial acupuncture. And what they say is some of them come for prevention. So the younger ones come for prevention. But all of them say that they're purpose, the main purpose for coming is it's a natural alternative that's more congruent with their belief systems. So we're going for a more natural look, a more healthy, radiant glow. But underneath that is something else. And it's a conflict for many, many people. It's a conflict with the concept of aging. What does that mean? What happens is as we age, something happens. There's a shift that occurs. And when you approach this, you have to get to that part. You have to help them to understand the conflict. The conflict can be multiple reasons. In 2016, I created this acupressure facelift kit. And before I started marketing it, I put it to the test and ran a pilot study. There were 12 people. They came in and they did a 20-day treatment. And after 3 days, they noted a significant improvement in wrinkle reduction, face tone, changes in their eyes, a lifting in their eyes and brows, cheeks, jawline, neck, and skin quality. But more importantly, they noted a difference in self-image. We had them answer questions before about things like sleep, health, relaxation. One of them was self-image. And then we had them we asked the same question afterwards. And there was a huge improvement in self-image. That to me is as rewarding as what else is going on. Wrinkle reduction, face tone, eyebrows, cheeks, jawline, neck, skin quality. The fact that you can help them to feel better about themselves. My motto is when you feel good, you look good, and looking good helps you to feel better about yourself and about others. It's about how you see yourself in the world and how you perceive the world in relationship to you. When I first started, my focus was on my treatment. It was taking in terms of my intake, I was very focused on my treatment diagnosis, my establishing my pattern disharmony, figuring out my treatment plan based on my Chinese medicine diagnostics and pattern disharmony, and then my treatment technique. What points am I going to use? How am I going to lift these eyebrows? Or how am I going to get rid of wrinkles? How am I going to make them feel healthy and young and soft and vibrant again? One of the, as over times, and I've been doing this for over almost 30 years, one of the things that I quickly realized that what's really important is establishing trust. And how do the patients feel about aging is getting underneath what they say. They're going to come in and they're going to say, I have my eyes, my wrinkles, no. But really, what are they saying? What's going on underneath? And it's really important to start with the question, how do you feel about aging? You may or may not get an honest answer right away. But as you continue with them and as you treat the underlying pattern disharmony, which isn't physical, it's emotional and psychodynamic, you help them to resolve how you feel about aging, because certain things happen in terms of life. There comes a time, and some of us have gone through it and some of us have not. You will. And there's a time in life, you call it your midlife crisis, call it whatever you want, but it's a time when there's something happens. And oftentimes for people, it starts when you look in the mirror. It starts when you see those visible signs of aging, particularly if your self-esteem or self-confidence is not as strong, and you rely on your outside appearance to validate what's going on underneath and to validate who you are.